You know, when you think about it, a doctor's visit is kind of like a detective story, right? You show up with the evidence, your symptoms, and the doctor has to piece together all the clues to solve the mystery of what's really going on. Well, today, we're cracking a really fascinating case, the mystery of the oral polyp. And just like any good detective story, it all starts with one single, perplexing clue. They're not just looking at the obvious. They're hunting for patterns, for hidden connections, and for that one tiny detail that can crack the entire case wide open. Because it's never just about what you see on the surface. It's about the story that clue is telling you about what's happening deep inside.
So meet our central mystery, the oral polyp. It's this fleshy growth a doctor might find in the ear canal. Now, what's absolutely key here is that last sentence. It's a clinical sign, not a diagnosis. Think of it like this. It's like finding a footprint at a crime scene. It proves something happened, but it doesn't tell you who did it or why. That's the detective's job. Okay, so every great investigation has to start somewhere. And in medicine, that's the interrogation room. This is where the doctor sits down with the patient to gather the first, most critical verbal clues, the testimony that's going to shape the entire investigation. The first question is often about any, discharge. And the answer here is a major fork in the road. Patient A describes something thick and sticky. Okay, that points our detective towards a chronic inflammatory condition. But patient B's story, persistent and bloodstained, that is way more alarming. That's a sign that could point to something as serious as a malignancy, cancer in other words. Two similar problems, but two vastly different initial clues. Let's move to our next clue, pain. Again, the type of symptom tells a story. Patient A's mild discomfort, yeah, that fits with our working theory. But patient B, oh, that deep, severe pain that gets worse at night is a classic red flag. The kind of pain that makes a medical detective sit up and take notice and immediately start suspecting something much more aggressive, like a carcinoma. The plot is definitely thickening.
And how about sounds? Tinnitus, that ringing in your ears, gives us another crucial clue. A steady, non-pulsatile ringing, like patient A's, is pretty common. But when patient B says they hear a pulsing sound, perfectly in sync with their own heartbeat, well, that's a whole different beast. That's called pulsatile tinnitus. And for our medical detective, man, alarm bells are going off.
So, why is that pulsating sound such a huge deal? Why the red flag? Because pulsatile tinnitus isn't just some annoyance, it's a major warning sign. It's a direct signal that the problem could be vascular, meaning related to blood vessels, like a rare type of growth called a glomus tumor. This one symptom completely changes the game.
So the interrogation deepens, with each question adding another layer to the story. The detective probes further. Is your hearing muffled in a way that you can hear sounds but can't understand words? Does the whole world spin when you touch your ear? And this one's critical. Have you noticed any changes in your smile? Any weakness in your face? Because that's a telltale sign a nerve might be under attack. Every single answer is a piece of the puzzle.
All right, we've gathered the testimony. Now it's time to visit the scene of the crime, the ear itself. The verbal clues have painted a picture. Now it's time to find some hard, physical evidence.
It almost seems too simple, doesn't it? I mean, really, after all those questions, could one simple physical action, just one touch, potentially solve the entire mystery? Well, in this case, the answer is a resounding yes.
This right here is the moment of truth, the probe test. As you can see, the doctor just gently touches the mass. They're looking for forensic details. Where is it attached? What's its consistency? Is it soft or firm? And then the million-dollar question that could change absolutely everything. Does it bleed? And here is the crucial takeaway. If that polyp bleeds, and bleeds a lot, the entire case changes. That quote uses a fancy medical term, pathogenetic, which basically means it's a dead giveaway, a total smoking gun. That bleeding is a classic sign of a vascular lesion, like that glomus tumor we mentioned. And trying to biopsy something like that in the office? Wow, that could lead to disastrous bleeding. So this simple test doesn't just provide a clue, it prevents a potential catastrophe.
Okay, all the clues are on the table. The testimony, the physical evidence. It's finally time to close the case. Let's see how our two very different trails of evidence lead to two shockingly different conclusions. Let's look at case file number 1. This is our patient A. The history was chronic, right? Sticky discharge and only mild discomfort. The examination revealed a pale, smooth polyp that was soft and barely bled. See? All the clues line up perfectly to point to a simple inflammatory oral polyp, probably caused by a chronic middle ear infection. A manageable problem. Case closed. But now, case file number 2, our patient B. The history was rapid and frankly frightening. Blood-tinged discharge, severe pain, and even that facial weakness. The examination found an irregular mass that bled like crazy on touch, and a firm lymph node was felt in the neck. Every single red flag we talked about was present. It all started with the exact same sign, an oral polyp. But following the clues led us to a completely different and far more life-threatening reality. So what's the ultimate takeaway from this medical mystery? It's that the hero of this story wasn't one single clue. It was the process itself, the systematic approach that pieced together every subtle detail, from the sound of a patient's tinnitus to a single drop of blood, to reveal the true story. And that right there is the art and science of medicine in action. Starting with a single, seemingly simple sign, a fleshy growth in the ear, and following the clues methodically. One path leads to reassurance and a simple treatment. The other path, guided by those red flags, leads to an urgent, life-saving diagnosis. It's the detective work that makes all the difference.
In the end, this case reminds us that our bodies are always communicating, always speaking a language of signs and symptoms. The question for all of us is, are we paying close enough attention? Are we listening for the quiet whispers before they're forced to become life-altering shouts?